You've been lied to. If you or someone you love ever tried to find a doctor through insurance, there's a good chance you've been caught in a ghost network scam. It's a list of fake or outdated or unavailable providers that make it impossible to get care you need. And now one of the biggest insurance companies, Anthem Blue Cross and Blue Shield, is being sued in a massive class action lawsuit in New York for this very reason. It's a life or death issue for people fighting cancer or struggling with mental health. Imagine this. You're desperate to find an in network insurance doctor for oncology or behavioral health services. You go onto the insurance portal and you see a long list of doctors who are supposed to take your plan. When you start calling, the numbers are disconnected, the doctors don't take your insurance, or worse, the office doesn't exist. This isn't bad luck, it's an intentional insurance scheme. These ghost networks exist because insurance companies want to look like they provide care without actually paying for it. Why? Because when providers drop out due to low reimbursement rates, insurance companies don't update their directories. Instead, they leave the bad information knowing that most people will give up or pay out of pocket expenses. Now, for the first time, Anthem Blue Cross and Blue Shield is facing a massive class action lawsuit in New York for ghost networks. The lawsuit claims that Anthem falsely advertised in network providers that weren't actually available, making it impossible for members like you to find real doctors. And the worst part, this hits most vulnerable people, like cancer patients and those seeking behavioral care. Imagine needing chemotherapy or psychiatric services and realizing that the doctors that you would like to get care for are not even available. This lawsuit could be the beginning for a major change, but until then, people are still suffering and we need to find different ways of acting. Patients are getting delayed or no treatment at all. Cancer patients waste weeks searching for oncologists, losing critical treatment time. Mental health patients struggle to find real therapists and are forced to go months without help. Parents looking for pediatric specialists are left to nowhere to turn. Those insurance companies are saving money while you suffer. They avoid paying claims by making it hard for you to find a provider. They push you towards out of network doctors, which cost you more money. But here's where you can take back control. Three ways to beat a ghost network and get real healthcare help. One, demand a real time provider list from your insurance company. Call your insurance company and ask for a real time, actively verified provider list. They are legally required to give you an updated information. Record the call if possible in your state. Number two, use state insurance departments to file in complaints. Each state has an insurance commissioner, and if you hit a ghost network, file a complaint immediately. This builds the pressure on insurers and can sometimes force them to pay for out of network care. Three, the third party tools and patient advocacy groups like websites like ZocDoc, Psychology Today, and Open Path Collective often have better provider lists. Nonprofits like Patient Advocate Foundation can help fight denials. And join advocacy groups that will fight for laws against these ghost networks. If these videos open your eyes, don't keep this information to yourself. Share this with someone who needs to know. Insurance companies want you to stay in the dark. Let's expose them together. Comment below and demand for real healthcare access. Don't forget to subscribe to stay informed of more eye opening healthcare exposes. Always remember, fight for your health and demand better healthcare.